this video I want to talk about communication and education in healthcare. Now the first thing I want to address is quality over quantity. Now, quality over quantity sounds cliche, but really I want you to think about that. If somebody really feels understood in 5 minutes, that's much better than just spending time with you for half an hour. So quality over quantity. When people feel like they really got one-on-one care and quality care, they felt listened to, they felt heard, and they felt understood. That comes with quality, not quantity. We all know that we've spent time with people and we never really feel like they understood us. They never really talked to us or knew who we were. Maybe that was a date you went on, maybe it was a car ride with somebody that you didn't really want to be on with, or whatever it may be. We all know that we've spent time with people and we got down to like, they don't really know me, and maybe you don't really know them. Maybe you know you didn't make the effort. Where there's sometimes when you can spend not very much time with people, the right questions are asked, somebody's caring, and that quality makes all the difference. So quality over quantity. The next thing is oftentimes when I first get in a room, I may stand here talking to the patient and I'm a little bit above them. If it's a quick check-in and I don't need to, and I'm not going to be spending much time, I may stay there. But if they have any concerns or I need to talk with them more, I'm going to come and I'm going to sit down. They may be in the chair next to me, they may be in the table in front of me. Sometimes I will just sit right on the table next to them, shoulder to shoulder. As I sit down with them, I'm at their level, and they know that I'm there to listen. I'm not just standing at the front of the room ready to jump out. I'm sitting there. I also want to touch early. Touch releases oxytocin. That's a bonding hormone, and I want to utilize that. And so I'm gonna, maybe it's a shake of the hand, maybe it's a hand on their shoulder, maybe it's a hug. I want to be able to touch them early. And so in initial examination, I also want to be able to touch where their pain is at. Okay, so it's right here. Is that the center of it? What about over here? So I really want to start having a dance with them so they know that I'm listening. I'm right there. If I can touch there, they know that I know where their symptoms are at. Even if I could imagine it, even if I already know. I remember one time I started treating somebody's knee, like, and the pain is right here. And I knew where it was. It was medial knee OA, mild medial knee OA. Knew where it was. I'm like, I'm sorry. I did know that, but you wouldn't have known that. I see this quite a bit. And so I messed up in that scenario. So I need to touch right there, but not right here, or more right here than right here. Where you get to touch them early. That is an important thing to do. And then you want to get their story. Sometimes I do that before the touching of their symptoms. I should touch them before, some type of hand on the shoulder or shaking the hand, but I want to get their story early on. That might be after I touch their symptom, it might be before. What are they here for? What else have they done? And then I want to label that story, so that way I can get that is right. Oftentimes they've said something that I disagree with, or something I'm not sure about. Maybe they're saying that, I need an MRI. I haven't had an MRI yet. And they said I had to come here so I could get an MRI. Or I don't know how anybody knows what's wrong with me. I haven't even had an MRI or an X-ray. Something along those lines. We've all had people tell us something they disagree with. Oftentimes, after the initial label, like this is where we're at, then I want to guide the examination, tell them what we're going to be doing. But I remember what they said. So that way I can label it later with more information. Because nobody cares how much you know until they know how much you care. That's cliche as well. But if you haven't spent enough time with them asking questions, they're not going to really care about you giving them more information. We also hear seek first to understand, then to be understood. There's no way that they believe that you understand them if you don't examine them and you don't ask them enough questions. Now, we know that a lot of times we don't need to understand anymore to be able to give that same recommendation. We could do that now or later, but we need to understand them more. They need to know that we understand them more, is really what it is. They need to know that we understand them before we can start making those recommendations. So after we do an examination and we understand them better, and really they know that we understand them better, then we can say, hey, you had mentioned this, and it sounds like you want an MRI, so you have a better idea of this, and so that way we can make sure we give you the best possible care. Is that accurate? Uh, yes, that is right. Do you mind if I share my thoughts on that? Oh, of course. Sometimes I don't even have to ask that. After I do enough, they say, well, yeah, that's what I wanted, but what do you think, doc? Okay, now I can, they're asking for my opinion. I don't want to give somebody my opinion if they don't want my opinion, because then they don't listen and it starts to create some confrontation. So again, early on I want to label, but I don't contradict anything. If I do find anything I disagree with, after they know that I understand them and that I care, hopefully they know that I care, but at least I understand them better because I've been describing them what I find. I want to then bring back that thing that they discussed earlier that I disagree with, if I think it needs to be corrected. Some people I disagree with them and I'm like, you know what, that's a minor thing, I don't need to focus on that. But if I know that I need to address it, then I bring it back and I label it. So it sounds like, you want this for this, or you think you need a surgery, or you think you need an injection, or you think you need, whatever it may be. So that way you can accomplish this. I mean, if they're in here for pain, they probably want to have less pain. They want it to be addressed appropriately. It's not rocket science to know why they would want some of those things. But you need to label it so that way it's both out in the open, what the concern is. And if you're wrong, then they can correct you. And then they can say, yes, that is right. Do you want my opinion on that? And maybe they don't. Sometimes they say, well, I know what I need. I don't think it matters what you say. Okay. Typically not though. Typically they'll say, yes, I want your opinion. And whatever recommendation you make, you need to frame it for them. Not, I don't like to do imaging that early, or I don't think injections are best. No, my concern is that if you have the imaging like that, it's going to show some things that aren't relevant to your pain, and it might start you down a path that you don't want. Then you might go see another specialist who then may recommend surgery or injections or stronger medications, things that I don't know are best for you. Or maybe they've already said that they don't want some of those things. Or I may just start to label, like, it may start you on a path of something that, we don't want, that you don't want to do. And then they can say, yeah, that is right. Okay, so we don't want to do that. And sometimes I've had these conversations over multiple visits. We do that one time and then they come back with the same concern. And then I do the same thing because it's hard for them to fully internalize it and to fully understand it, because their background is their perspective. And I can't emphasize that enough. Their background is their perspective, and it's hard to fully change. They may change a little and understand a little bit, but then they think about it in a different manner, and then we have to re-educate that way as well. And then they think about it in a different manner, and they go back to their original thought, and we have to educate there. But as long as they're looking for your opinion, or you seek to make sure that they're all right with your opinion, you can keep addressing that as needed. Or maybe there's something you missed and they actually do need. They actually do need MRI, or maybe an injection is the best option for them. That is the case sometimes, right? Or maybe a surgery is the best option. They were thinking they needed it and you agree. But it's when you don't agree that is the difficult part. Most of the time, education isn't so much how we word it, although there's part of that, or what we're going to say. It's how do we precede that? How do we build up to it so that way they're looking for that education? And remember, their background frames their perspective. And whatever we say, we need to emphasize it in terms of them, not about us. It's not that I don't want you to have that. It's that I'm concerned if you do, that you're going to be frustrated, that you're going to end up with an injection and there could be a complication, or that you're still not going to be better and there may be some adverse side effects, or you're going to, heaven forbid, have a surgery and you're no better, or you're even a little bit worse. That's what I don't want for them. And that's really what we all are trying to say, but sometimes it's easy to say, well, I don't think this is best. They don't care what you think is best. They care what's ever best for them. So we need to frame it for them. Now, we're nearing the end of the session. I don't like abrupt ends. So you've been talking, okay, well, I'll see you later. No, okay, we're gonna do this one more thing, and then we're gonna be wrapping up. You're getting near the end. If all you have left is education, let's talk a little bit, and then we'll address, what we're gonna do for scheduling. So that way they know when it's coming to a close. You don't, because we have the peak end effect. They'll remember the best or the worst part of it, and also the very end. And if you smoothly do it at the end of the session, they're gonna have positive memory of you. So you wanna make sure you prep for the end just a little bit. Then the last thing is, then we're gonna be talking about scheduling. So here we have these scheduling slips. So we have an idea in our mind what is best for scheduling. We go to fill it out. This may be first session, this may be subsequent sessions. Oftentimes, people are like, okay, yeah, whatever you say. Sometimes they'll have a concern, oh, I can't make it in that often. Okay, let's see what we can do. Or they may say, I need to be coming in more than that. I don't think that's going to be enough. And now some of the concern for that is maybe you don't have enough room on your schedule for them. Or maybe you disagree. Maybe you think that's overutilization of care, that they don't need to be coming in that much. Whatever it may be, we need to find out what they're thinking. And oftentimes, this is where motivational interviewing, we talk about rolling with resistance. We think that something's best for them and they disagree. Okay, can we just roll with it? Okay, let's try that out for a couple weeks and see. If it's not a big deal, just roll with it. Sometimes we may need to say, okay, I don't know if that's going to be able to work with my schedule. It's a classic technique of how is that going to work? So I don't know if that's going to work for my schedule. I'll write it on here and I'll put if possible. And then hopefully so, but if not, you want to say hopefully so, even if you don't really want it to be hopefully so. What you're really saying is hopefully this is going to work out for you. Hopefully so, but if not, I'm confident we can still get there with what we talked about. And so what you want to do is make sure that you're on the same page. If it's you versus them, that's not where we want it to be. We want to be on the same team. And so that is a crucial aspect of scheduling as well, because if the whole week they're thinking, man, I'm not getting what I think I should be getting, I'm not going to get better without that, then they're not going to get the improvement that you were hoping for, even if your will, what you thought was best, wins out. Try to be on the same page, roll with the resistance, only fight it if you really need to, and make sure to do it well to hopefully bring them up to where you are, and not have it be a conflict or something that ends with feeling a negative way. You want to agree on the scheduling going forth, the plan going forth. So that's communication and education in healthcare. Most of it is about making sure to set the stage, making sure that they know that you understand, making sure they know that you care. A lot of cliches, but things that can be difficult to do and really to do well. So that way when you do need to communicate something important, they are ready to hear it. It's all about the prep work. And it takes a lot of hard work, but it is rewarding and it is effective.